everyone. If you or your family member or a friend is experiencing a pain or a nail which is compressing over the skin fold and having a pain or discomfort and wondering what exactly it is or if the treatment options are available, and I'm here to discuss about it, the condition called as ingrown toenail. Myself, Dr. Priya Prem from the Department of Dermatosurgery, Cutis Academy of Cutaneous Sciences, Bangalore. The nail normally has to grow in length. In this condition, what happens is the nail, along with the length, it starts growing inside the skin. That is, the transverse curvature of the nail is increased, which will lead to pain, discomfort, swelling, and sometimes secondary bacterial infection. Few conditions where we commonly see ingrown toenail is in people who has the habit of cutting the nail very short, and usually in patients who are wearing the tight fitting or the ill fitting shoes, and sometimes secondary to trauma or can be hereditary. There are few measures which can be taken to avoid developing the ingrown toenail, that is avoiding over aggressive trimming of the nail plate and cutting the nail linearly than the curvilinear, and using the properly fitting shoes. The ingrown toenail presentation might be vary from having a minimal discomfort to a mild to severe pain, and sometimes the swelling of the surrounding skin, and it might be in the severe form as the hypertrophy of the surrounding skin. In patients who are having recurrent symptoms or in severe pain, the surgical treatment acts as the best mode of treatment, that is the partial nail avulsion and chemical matrixectomy. Prior to the surgery, there are few basic investigation which has to be done, and the nail which is growing inside the skin or which is causing the symptoms, only that part of the nail has to be removed. So the initial marking is done, and following that, to make the surgery painless, the local anesthetic injection is given to only the finger which is being operated. The surgery includes the removing of the nail plate which is growing inwards, which is separated from the surrounding skin, and the nail is separated. To avoid the nail regrowth from the same site, a procedure is done called as chemical matrixectomy by use of 88% phenol and 100% TCA. Following the surgery, there will be a tight dressing which is done, and the tight dressing has to be there intact for 48 hours, and the patient is advised for rest and immobilization. After 48 hours, when the dressing is opened, if the site looks normal and there is no secondary infection, the dressing is not required, and the site can be left open, and advised for saline compression or saline soaks and antibiotic drops. Post surgery, oral antibiotics is given for 5 to 7 days, and oral analgesics will be given. In patients who are having minimal symptoms or who wants to postpone the surgery, then the few measures can be taken to postpone the surgery. That is, by the use of dental floss or cotton wisp or plastic tube can be used as a splint between the nail plate and the nail fold. Also, the use of adhesive tape can be used to pull the surrounding nail skin coming in contact with the nail plate. In case you have similar complaints or any other queries, please do contact us at Cutis Hospital, Bangalore. Thank you.